it's now tax season. And this tax season, the best place to get your taxes done is at Spectrum Tax Group. We've specialized in doing taxes anywhere in the US. It's very convenient. You can do your taxes just from your mobile phone with your mobile app. You can log on to our Instagram at Spectrum Tax Group. That's SPECTRUMTAXGROUP. That's Spectrum Tax Group on Instagram. You can log on to our website at spectrumtaxgroup.net. All right? So if it's this tax season, you need a good, reliable tax person, hit us up over at Spectrum Tax Group. We'll take good care of you. All right? Peace out.
Hey everyone, we are back again for another episode of the Student to Life podcast, where learning and unlearning has no limits. I'm your host, Shanta, and this is my co-host,
Stretch.
And we are so excited to be here today, guys. We have the wonderful Dr. Doncour. Did I say it right?
Yeah.
Dr. Doncour, and we want you to just tell us a little bit about yourself.
Okay, well, first of all, I appreciate you inviting me here. This is it's a great honor to be here. So, I'm a board-certified general and bariatric surgeon. I specialize in robotic, minimally invasive surgery for weight loss and advanced GI pathologies. So I do a lot of different types of surgery. I deal with a lot of patients with cancer, weight loss, nutrition, and all that stuff.
Cool. That sounds like everything that we need to know about now and how to avoid being in your office.
And you know, he got some high words today, guys. So we're gonna have to, suck in on what he's saying because it's gonna be some great information.
Tell us, how long have you been doing this?
So I've been in practice down here in Florida for the last probably 11 years. I trained at University of Miami, Jackson Memorial, and Harlem Hospital, Columbia University, New York City. And currently I'm the medical director of the bariatric program at the HCA University Hospital. And I'm the founder of the Center for Advanced Robotic and Endoscopic Surgery, which is the CARES Clinic. And we've been up and running for a while now. We're very busy, and we just love to give the highest quality care to our patients and take care of the things that we're doing.
Okay, so what's your alma mater? Like, because a lot of people, they chalk up a lot of things to the school you went to, and they want to talk about that. So what's your alma mater?
Oh, okay, that's good. So I actually went to college in Canada. I went to University of Western Ontario. I was Mustang, yeah. And I wrestled collegiate for them, and yeah, I did some sports back then, and so I guess I would say that. And then training took me over here, and with residency, Miami, New York City, and then my fellowship back in Miami at Baptist Health, South Florida.
Were you always interested in being in the medical field?
I
Growing up
was.
as a kid?
Yeah, I was interested. I don't know. I always. I think when I got to college, I kind of deviated. Was looking more at the sciences and the math. I was big into math and biochemistry. And then I went into door-to-door sales after I graduated, and I did a year of that, knocking on doors in the snow, trying to get deals. Not making any money, and then I decided I was going to go back. I was going to go back and follow my dream and go to medical school. Okay. So I did it.
So you practice out of your own office, or you do your work out of the hospital?
So I do surgery. So the surgery that I do is in a big hospital because I do a lot of big, major, complex surgeries, and I do have my own office where I see my patients, evaluate them, consult with them. And then if it's something small, I'll take care of it in my office. If it's something big, then we do it in the hospital.
Okay. So you have a staff that you work with. Did you have a general staff, or you do have just anybody that's available?
No. I have a full practice that's up and running. I have 2 offices. I have one in Davie. I have one in Plantation. Like I said, I'm the director of the bariatric program that I developed at University Hospital. I'm the vice chief of surgery at Westside Regional Medical Center. I'm the chairman of the robotics committee.
Right.
So and then I'm also faculty for the residents training program, basically training the new surgeons that'll be operating on us one day.
So for the people that might not know what exactly robotics is, can you give us like a small definition?
And bariatric surgery.
Yeah, that's a great question. So robotic surgery is the use of a robotic platform which is from the company Intuitive Surgical, and it allows us to use small incisions to perform complex surgeries. So instead of zipping you all the way open, we were able to make small little incisions and put these complex little instruments in there and do these very delicate surgeries. And then bariatric surgery is surgery for weight loss. So that includes the gastric bypass, the sleeve gastrectomy, and other stuff. But basically, I'm able to perform complex surgeries with small incisions. So you may undergo a big major surgery, but the next day you're up and out of bed, you're walking around, and you feel great because you have minimal trauma to your body because it's been done through the least invasive technique.
And that means the recovery is a lot
Recovery is
faster.
quicker, your time to get back to work is quicker, your post-op pain is less, your infection is less. It's just all around better.
I love that because a lot of people when your recovery is 2-3 weeks just
Yes.
just to even get up.
Of course, yeah, it makes a big difference. And so I actually spent an extra year of training after my general surgical training to specialize in this. That's called a fellowship, and I did that at Baptist Health in Miami.
Okay. So I'm curious to know, what is the typical type of patient that you see on a regular basis that comes in?
So, for example, for my patients that are seeking a solution to having long-term obesity or weight issues, patients will typically be, over a body mass index of 35 or higher, or even maybe 30 or higher, dealing with things like diabetes, blood pressure, sleep apnea, joint pain, depression, all those things. And so we counsel them, work on their nutritional goals and plans, and then put them through the process. And if they're not able to lose weight with the traditional methods, then we start getting them ready for surgery.
Oh, so you do the traditional way by diet?
Yeah,
and
of course.
exercise.
Listen, you come to my office and you will see me. I'm going to give you a lot of information, and we're going to work on your diet. We're going to work on exercise. I have a nutritional coach who's very good at modulating your diet and putting you on a very good exercise routine. We try that. Some patients are just the metabolism is just not in their genes, and so even though they diet, they exercise, they're not losing the weight, or they're not losing enough weight quick enough. I even have patients that are wheelchair bound or not able to exercise because of the excess weight that they have.
Okay.
And so those are patients who are great candidates for the surgery.
So you're not like the BBL surgeons who just do it.
No. I'm not a plastic surgeon. I'm not a cosmetic surgeon. So I don't do surgery. Nothing against that. Definitely, it's definitely for a certain group of people, but that's not what I do. I see patients who have diabetes that is out of control, blood pressure, they're on multiple medications, they can't sleep because they have severe sleep apnea, they can't walk because they have severe joint pain, and then I give them a solution. You lose a lot of weight, your blood pressure gets better, your diabetes goes away, you can get back in the gym, you get your life back.
So you did say that you do have patients that are wheelchair bound, but I do understand that with a certain weight level that you cannot perform surgery. So are those wheelchair bound clients
Yes,
more?
it's very difficult, right? Because as you have a higher weight, right? As your weight increases, your risk increases, right? Risk of going under anesthesia, post-op complications, all those things. So there's a balance, but I also don't withhold surgery from people who are not able to lose the weight because of extenuating circumstances. So we put them on a very strict diet program. We get them to lose a little bit of weight to get them healthy enough to get into surgery, and we operate. We don't push people to the side. We always come up with a solution.
So you're solution based. But we had this conversation like on the last 2 episodes actually. We had the whole BBL conversation where a lot of people they go do the surgery, but there's no discipline to maintain that. You get what I'm saying? Like you go do a BBL or whatever you do, but you don't have the practices in order to maintain that investment that you made in your body to go get the body done. And now you're still eating bad. You're still not working out.
So that's a great point. So there's two sides to that, right? So number one, the patient comes in, wants a quick fix,
Right.
and number two, the surgeon doesn't offer a comprehensive program.
Right.
I'm going to do your BBL, I'm going to do this, I'm going to do that, but I'm really not going to address your nutritional status. I'm not going to address your dietary habits. I'm not going to address your activity level, your exercise habits, and I'm just going to do the quick BBL. And so a lot of those patients, they come back and they don't do well.
Right.
The other thing is, are we selecting the right patients to undergo those surgeries? So I've seen, unfortunately, patients that have undergone BBLs and liposuction that are way over the limit that it would be successful, right? So there's a certain limit where a cosmetic procedure is not going to be beneficial to you, and a weight loss surgery and a comprehensive diet and exercise program is going to be successful.
Right.
The other thing is there's another avenue that's also out there, especially recently, if you've seen in the news, there's a new set of medications, weight loss medications, that actually have very good results.
Right.
And they're called GLP-1 agonists. You've probably heard of Ozempic and Wegovy and Saxenda. So this is another way to help people to facilitate weight loss.
Okay.
Now, does that generally, in your field, for being a weight loss surgeon, do you have a lot of patients that will get a successful surgery and then months later you see them and they've gained all the weight back, or years later?
Yeah, not months later, but years later we can see some weight regain. It depends on how your program is. My patients stay close to me, they follow up with me, and I think they do better for that reason. But there's always, the body is always trying to put back weight on. That's just, that's a evolutionary problem that we have. So when you lose weight, especially a large amount of weight, your body's going to try to put weight back on. It's also metabolism based, so if your metabolism is very slow, it's going to be more difficult for you to keep the weight off.
Right.
The most important thing is understanding the procedure that you're doing, getting the right procedure done, having the procedure done correctly with good technique, right? So having a surgeon that's board certified, very important. I'll say it again to the camera, board certified. And then following up with your physician. It's really important. I sneeze. Sorry. Okay.
Got it? You got it?
Yeah, I'm good.
All right, so the major question now that we're going to get to is, what brings people to your office? Like, that's what we want to know. Like, what are the different things that cause people to end up in your office wanting to get these procedures?
Well, listen. First of all, I do other stuff other than weight loss surgery.
That's what I mean. Like,
I do
everything overall, or everything.
So I do breast cancer, right? So so breast cancer is extremely important, especially when we're talking about women's health, right? So an overall 12% lifetime risk, and 1 in 8 women will be diagnosed with some form of breast cancer, right? So what's important for that? Screening, mammography, ultrasound, self-breast examinations. So any female that ends up with a lump in their breast or some type of finding on an imaging that's maybe it's concerning, they'll be referred to my office.
Okay.
I've been doing breast surgery for the last 12 years. I do a lot of colon surgery, so colon cancer. Colon cancer, especially in our community, the African American community, is increasing. And the age that we're getting colon cancer is younger. So one thing I could stress is, what's our diet like? Are we eating enough fiber, enough fruits and vegetables? Are we getting our colonoscopy screenings? It used to be at the age of 50. We moved it up to the age of 45. And I even say if you have risk factors, anybody in your family has had colon cancer, you can get it earlier than that.
Before you go any further, like a lot of guys, a lot of men, I could tell you about Caribbean men. They're not going.
Especially the Jamaican men.
Right, exactly. Jamaican men, they're not
problem.
going to get that colonoscopy done because of the procedure.
It's a problem.
Is there any other way to do it, like other than the original way? Because that's what a lot of guys ask me.
You need to get your colonoscopy done, okay?
Regardless of how it's done.
Yeah, because the problem is that once you develop a cancer, we missed the cancer, right? Colonoscopy is the best screening. You do have other things like Cologuard. You can check your stool for blood, but the best screening tool that we have is the colonoscopy. Age 45, you need to get your colonoscopy. If you have a family member with history of colon cancer, younger than that, you need to get it 10 years before that. Bottom line. Because then what happens is you develop a tumor, something happens, and now you got to come see me. And now I got to tell you that I have to remove this amount of your colon, and you might need to have a bag.
So I mean,
Right.
You're living with that bag.
Not all the time, but sometimes.
so my grandfather passed away from prostate cancer.
Okay, prostate's another one.
Yes. So I was gonna
I
ask
want to
you,
ask you a lot about that.
what
but
was
go ahead.
the so colon is your gut.
Yeah, colon is, so you have the large intestine, the small intestine. The large intestine is at the end of your intestinal tract, and that's where you start to, you reabsorb the water and some nutrients, and that's where you form the stool. And then it goes out to your rectum and to your butt, and that's where you poop out, okay? Prostate is within your abdominal cavity. It sits just in between your rectum and your bladder, and yes, prostate cancer is the most common cancer in men. Breast cancer is the most common cancer in women. And then colon cancer is the most common cancer, is the third most common cancer in both groups.
So why is it the most common cancer in men? Prostate. Women don't have like a prostate?
No,
gland?
you do not.
Okay, I'm sorry.
Women have a
know.
uterus.
So
it's
that's what I
okay.
wanted to ask you about.
So
now.
that's how we could get uterine cancer as well.
Yes,
right?
women get uterine cancer. Men don't.
I wanted to
Okay.
ask you about the prostate thing because I was watching an interview where the guy was saying that your prostate is what helps your if you have erectile dysfunction, that's where it starts at.
Well, yeah, it's all related. So yeah, there's some prostate surgery that can affect your, erection and function and everything. But there's different treatments. They have, radiation. They have they have less invasive things.
Right. So basically, what he was saying was, it's like the prostate or is like a muscle that if like for instance, for people who have sex like every single day, if that muscle doesn't get a chance to rest, it wears out after a certain time. Like you get to a certain age and that muscle
I
doesn't.
don't
I don't know how true that is. Like, you're the doctor, so I'm asking you.
I'm not a urologist, but I have some urologist friends that I could ask. But yeah, I'm not sure about that.
Okay.
Yeah.
So
Yeah.
that one I was still trying to get answers on it, but he was speaking about it like he knew what he was talking
Okay.
about. So I really wanted
Okay.
to know about the prostate side. And
But the
how-
prostate's very important. Prostate's number one the cancer developed in men.
you know what causes that?
Well, hormone related, and obviously, cancers have been, I think we're detecting cancers at a higher rate now. The general things that will cause you to develop cancer, just broadly speaking, is always going to be smoking. I think I'm sipping on Tito's, but alcohol, obesity, previous radiation, those type of things. But there's most commonly it'll be just a defect in a genetic mutation. At some point, something happens. It's like a factory line, and then something happens at one point in the factory line, and it just messes everything up going on all the way behind it.
What about it being hereditary?
Of course, yeah, cancer and being hereditary is always a factor.
Right.
So back to the colon, right? Now, would you recommend, because they have so many colon detoxes and all this stuff,
Yeah.
is a detox something that you would recommend, or is it to go in professionally
I think
just
it's
have it?
a great question. So colon cleanse, gallbladder cleanse, liver cleanse, all that stuff. So I have to speak in terms of data, science, evidence-based medicine, evidence-based practice. So if I was to tell you that a colon cleanse or a liver cleanse is going to help you, it is going to do anything that has any clinical impact on you, that means it's going to really make a difference, I wouldn't be responsible because there's no data to show that. So it doesn't mean it's going to hurt you, but I can't tell you that, yes, you should do a colon cleanse. What I can tell you is the body is much more complicated than a car, right? So you just there's certain bacteria that your gut needs to have, that your colon needs to have. There's certain bacteria that needs to be there. So you don't need to wash out that bacteria.
All of it, yeah.
You don't want to create an imbalance and then have other bacteria overgrow because you washed out a bunch of the good bacteria. So I don't recommend colon cleanse. What I do recommend is having a healthy, well-balanced diet, high in fruits and vegetables and fiber. Okay?
So there's good bacteria and there's bad bacteria.
Yeah, well, I don't even want to say there's bad bacteria. I think what happens is we get an imbalance. And then so certain bacteria overgrows and all of a sudden it becomes bad bacteria to you because you have more of that bacteria. That's why we don't like to overprescribe antibiotics. You overprescribe antibiotics, what happens? You end up getting an infection from the fact that you've been on too many antibiotics.
Okay. So what would you say is like the common risk in weight loss surgery?
Common risks. So common risks are immediate risk from the surgery. Any surgery that I'm doing on a patient, whether it's just removing a fingernail or doing a big complex surgery, there's always a risk of bleeding, always a risk of infection. And then specifically to weight loss surgery is immediately, is there a risk of a leak where you stapled and you cut along the stomach. It can break down, it can leak. It's not often, it's very rare, but it does happen. And then also you can have acid reflux, which typically goes away after you lose weight. You can have ulceration, but it's really the risk profile is really low. So the way we look at it is risk versus benefit. So what's your risk of being at that weight, not having surgery and not losing the weight versus having the surgery? And the risk of staying at that weight is much higher.
Right. So you could lose your life by
Heart disease, heart attack, cancer, diabetes, stroke, kidney disease, and the list goes on.
So the risk is higher not to.
The risk is higher. Now, obviously, if you're 10 pounds overweight, we're not talking about those people.
Right.
We're talking to people who are typically a body mass index of 35 or higher, which is about 75 to 100 pounds overweight.
Hello everyone. We took this quick break out of the podcast, out of the education and everything, to let you know we're sponsored by Moments Bar and Grill right here in Tamarack, Florida. That's 6455 West Commercial Boulevard right here in Tamarack. They have food here. They have an open bar, nice venue. You can come here on a Thursday for karaoke. You come here on a Friday for seduce. You come on a Saturday for sultry. They have everything. They have a restaurant during the daytime.
Yep.
So make sure you come here and check out Moments Bar and Grill, 6455 West Commercial Boulevard right here in Tamarack. I'm not sure if you're able to speak on this, but a good doctor is very hard to find, like, and a general practice doctor.
I agree.
It's very hard to find, and a lot of times we, especially black people, I would say, go in a lot of offices, and they would like look at you and be like, "Oh, this is what's wrong with you," and send you on your way. I had a friend back a couple years ago. She went to Jamaica, and she was feeling some stomach pain. Before she went down there, she went to the doctor, and they prescribed her medicine for gas. They prescribed her medicine for menstrual pains,
Sounds
stuff
bad
like
already.
that. The whole time she had cancer.
Yeah.
They
Is it stomach cancer?
Yes. And it was too far gone when she
Yeah.
went to Jamaica and came back. They couldn't save her. Like, she literally started to change color, her skin started to change color and all that stuff. Like, she was already gone. Her liver was almost gone, so they couldn't save her again. So what's your opinion on like doctors not doing a thorough check and then send you on your way with medication?
Yeah, so I agree. So listen, so if you have your physician and you don't feel like your physician is listening to you, because I always tell my patients, you know your body better than I do. I'm a professional. I've been doing this for a long time, so I'm going to give you my assessment. But at the end of the day, you know your body. You've been in your body your whole life. I haven't. So if you feel like your physician is not listening to you, or you feel like your problem warrants more investigation and your physician is not listening to you, then it is okay to go see another doctor or get a second opinion. And it might not be anything that's significant, but you definitely need to have a peace of mind where you feel like, okay, we did this test, we did that test. Especially in the African American community, yes, we're not listened to as patients. We're dismissed. Our pain is not dealt with. And then on top of that, we don't trust the medical field, so we don't follow up.
Right.
We don't listen to the doctor. So the whole thing is a recipe for a disaster. So definitely, if you feel like your doctor's not listening to you, he's not respecting, your opinion, then you should get a second opinion or see another doctor.
Right. Go ahead.
So I know this is a question that's a little bit, out there, but have you had any complicated surgeries, through the years that you've been practicing, and how have you went about that?
Yeah, I've had a lot of complicated surgeries. I've actually, developed a name for doing complicated surgeries. So I do a lot of surgeries. I get a lot of patients that have been operated, actually a lot that have been operated in other countries. I've had surgeries elsewhere. I've had patients that can't can't find a surgeon that will operate on them. They say they're too risky. So I do have a niche practice where I do operate on. Doesn't mean you have to come see me, but but I do have a niche practice where I do see a lot of complicated patients, and I do a lot of complex surgeries. And in those cases, I just have an honest conversation with my patient and let them know that I'm not perfect. I'll try my best. I'll operate on you like I'm operating on one of my family members. I'll do everything I can, but especially in surgery, nothing is guaranteed. There's always risks of a complication, always risk of something happening. So you have to just take the bumps in the road and when there's an issue, we deal with it, and then we move on to the next issue, and then eventually we get you through it.
That's great. I listen to, like I said, I intake a lot of podcasts, and when I was watching one, I can't remember his name right now, but he talks about stem cells.
Okay.
I don't know if you're experienced or you know anything about stem cells.
So I'm not an expert in stem cells. Those will be the guys that are the orthopedic surgeons who use the stem cells for, if you have joint pain, if you're trying to regenerate any tissue that's, damaged.
Right.
They do use stem cells in certain cancers, like amyloidosis, which is a blood disorder. He'll give you a stem cell. So in that case, stem cells, we know that stem cell treatment in these certain cancers is a treatment. As far as for what the athletes are using it, I can't really speak on that, except for the fact that I would tell anybody that's thinking about going and getting stem cells, PRP, all these infusions, do your due diligence, do your homework, and be extra mindful before you start spending a lot of money. Because you want to look at what the actual science is showing. So if it works on LeBron James,
It might have worked for you.
doesn't mean it's going to work. Doesn't mean it's going to work for you. It's got to work on more than one person or two people or three famous athletes. It's got to work on thousands of people. And this is where drug trials come in, right? We test these medications on thousands of people. We look at the data and we say, yeah, it works. Or we say, it didn't really work so well.
Have you ever had a patient that people counted out that, okay, cancer took you already, and they actually brought themselves back to normal from that, like found ways to either treat it? Like some people I have heard change their diets. Just by changing their diets, they have, came back to
Yeah, so listen, the human body is amazing. There's things it can do that you'd be like, wow, I can't believe that.
Right.
I'm always more aggressive. So if there's a patient who has terminal cancer and they say, no surgery, there's nothing to do, but it's within reason and it can help the patient and everybody's on the same page, then I will go ahead and do, whatever type of surgery I think I can do. I have had patients that have done really well from whatever treatments they've done. But it's tough. Cancer is tough. Cancer is a tough thing to beat. The key with cancer is to prevent it, number one, and to catch it early. Prevent it, number one, catch it early. How you prevent it? Colonoscopies, prostate exams, mammograms, right? And also diet, exercise, lose weight, no smoking, minimize the alcohol. A little bit of alcohol here, there is not an issue.
Right.
But these type of things. Vaping is another thing that is popular, but it's not good for you.
I'm kind of glad you brought that up too. I think it's an epidemic now.
Definitely.
With the vaping and the hookahs.
The hookahs also, these are toxins that are going into your. It's a strain on your system. So. It takes it's a lag of time before we get to see what the results are, right? But we'll see the results in 5-10 years.
I think a lot of people don't recognize that it's actually tobacco. A lot of people don't know it's just like smoking cigarettes. So we see people doing it and it's cool to blow the smoke, but we're not realizing that it's addictive. It has the same tobacco as like a cigarette, and it could actually cause the same problems that a cigarette causes. So like I always tell people, like, especially the vape pens, those are probably, I think those are worse than even the hookah itself. You know what I'm saying? So what about like smoking actual marijuana though? Does that type of smoke affect the body in that way too?
So I believe there's can't quote me on this, but I believe a study just came out. I believe it was in Medscape, and they looked at effects of marijuana on your lungs as opposed to regular cigarettes. And I believe that marijuana does affect your lungs in a negative way. I'm not sure to the exact extent. We all know that cigarettes is highly carcinogenic. I think marijuana may be less. But I just feel like if you're doing anything too much to your body, it's probably not a good thing. Right? Like if you are drinking too much, not a good thing. You drink in moderation, fine. You smoking too much at all, it's not good.
So smoking is way more dangerous than drinking.
I mean, drinking, the problem with drinking is drinking can really affect other systems like your liver, and drinking is tough. And then also vaping. Vaping is definitely affecting these kids' lungs, big time.
Yeah.
And that's not even talking about the psychological aspect where they're just addicted to like having to have a vape pen in their hand and having to do this motion.
Right.
I'm sorry, I was all into that because that's such a. I mean, I already.
Listen.
No, I mean I already know.
I'm not even. It's not like I'm not saying I haven't done.
I mean, I don't smoke cigarettes.
Yeah.
I'm a greenery girl.
You're greenery, yeah. So I
just to make that clear, guys. Okay.
So like I said, I don't judge. I think I just think we all have to. Your body is your temple, so you always want to do what's best for your.
And I work out, like you said. I just believe in balance in life because you can have the healthiest diet and go outside and get hit by a car, and you're like,
yes, that's true.
So for me, I just believe in a healthy diet, work out, make sure your mental health is good,
mental health,
and do the things that you do in moderation. Too much of anything is bad for you, like you said.
Exactly.
So it's. And back in the days, in the 80s, they were taking down cigarettes. In the 70s, taking down cigarettes. And these people are still made it to the 90s. You know what I'm saying?
Not all of them.
Not all of them, but, it's anything that could take you out. But I do understand the risk factors of it, especially with the vapes and the hookahs and all that.
Yeah, it's just, listen, I'm not saying you can't, I'm just saying, obviously, it's not going to be the most positive impact on your body. Right?
Right. So I know in this field, you probably dealt with a lot of people that's going through like mental issues and stuff like that, but nobody ever asks the doctor like how does this work affect them mentally, because I know there's doctors that lost patients. I've had a friend who was a doctor, she lost a patient and she could not handle it, like she was broken up. But I think after a while, if it happened more than once, a lot of doctors they kind of get immune to it in a way, but nobody ever asks the doctor like how does this affect you mentally.
Yeah, it's tough. I remember every single patient I've ever lost. There was a point when I was in New York City, I was doing a lot of trauma out there, so I was taking care of a lot of young men that were getting shot, getting stabbed. You can't save all of them.
Right.
Even in Miami, I was at Jackson Ryder Trauma Center, which is very busy. And it's just a lot of trauma, and you remember everyone. For me anyways, I don't know about other physicians, but it's definitely, it affects you.
How do you deal with that?
Yeah, how do you go, what's the space that you go into outside when
I play basketball with these guys.
That's
These
good.
guys stress me out even more.
Make sure
Yeah.
But no, I try to stay healthy. I try to exercise. I play a lot of basketball, and I think that really, spend time with the family, and that really, helps me feel like grounded. But
any therapy at all?
Yeah.
I haven't done therapy, but I think I try to stay active as much as possible. But yeah, it's not easy. I mean, I deal with a lot of cancer patients now, and you lose them, and it's tough because you do whatever you can to save them, and then the cancer comes back. You do something again, the cancer comes back, and then and you just know it's coming, and it's coming, and it's coming, and then you get close to the family, and then you get attached to the patient.
Right.
Then I always tell myself, I'm not going to get attached to the patient. I'm not going to be personal with them. I'm not going to give them my cell phone, and then it's like, you get attached, and then they're not here.
Yeah.
And it's tough.
What about something like a hernia? Like, I've heard people say it here and there, but I never actually knew what it was.
Oh, good question. So hernia is something I also do a lot. I've also published online publications on hernia repair and how to do it and the best technique. So a hernia is really just a split in your muscle, in your abdominal wall, typically in your groin areas or in the midline.
Right.
And because it's a split in the muscle, the intestine can pop through. And if it pops through, it gets strangulated. If it gets strangulated, you're in an emergency, and you need to fix it right away. Okay. If you do have a hernia, like a sports hernia or a hernia in your groin or abdominal area, you should get it fixed. before it becomes bigger and becomes a problem. I think the key with the body is like a car, right? If you hear that, see that little engine sign come up? You gotta go get that, go get it checked out right away. So we need to take care of our bodies, eat right, exercise, and you need to see your doctor regularly, and you need to check things often just to make sure everything is working right and there's no issues popping up that you don't know about.
I was going through your Instagram today, and I saw you remove like things from people's bodies, and I'm like, wow, this is like crazy. That people have these things.
You
in their
had this
bodies.
organ that was like blowing up, and it was like.
Oh, so that was the stomach. You should probably cut a video in, but
Yeah,
the
we should
stomach.
That was huge.
Yeah.
So that was it's called a sleeve gastrectomy, and I removed that part of the stomach. So the patient, I left her with a little thin, like little sleeve, little banana-sized stomach, but that stomach, and she was a small girl, but I mean big, but not a large stature, and the stomach was huge, and she's going to lose about a good 100, 120 pounds from that.
So it's funny you said that it was a woman, because in our last episode we were talking about with our trainer, with the trainer. What was it? Not gallbladder. Not.
She said a word, but it's like
It's not kidney stones.
Fibroids. It's like
Fibroids.
fibroids.
Yeah.
Okay.
Fibroids. Yeah.
Okay.
Yes.
Fibroids. So uterine fibroids are on the uterus, and they can cause pain, they can cause bleeding, anemia. I don't deal with that specifically because
Okay.
I am. I don't. That's a gynecologist that would deal with that. But actually, on my Instagram, I do have a video of a patient that came over from, I believe, the Bahamas, and we removed a 50-kilogram fibroid.
Wow.
50-pound, not kilogram. 50-pound. If you see the video, it's this big, and her
That's
abdomen.
the one I saw.
Yes,
That's the one
and those
I
were
saw.
fibroids. So I was called into the case to assist the gynecologist because it was a big, complicated case, and that's how I got into that one.
So
And she did great.
I don't know if you know much about this part, but when I used to be a trainer, I used to be a personal trainer.
Oh, okay.
So a lot of times when a client has like a fibroid, they'll tell me they can't work out.
Really?
I don't know why that is, because they would tell me they're in a lot of pain. When
Yeah,
they work
probably
out and
pain.
stuff like that. But what is the reason? You know the reason for that? Why most people can't work out?
Well, I don't know if most people can't work out. First of all, everybody handles pain differently, and if the fibroids grow very big, they put a lot of pressure. And if you're doing sit-ups and any core activity and squats, I'm sure they're feeling pressure, and it's causing them pain. I would assume.
I think the other one she says was PCOS. I think that's the name. of it.
Yeah, polycystic ovarian syndrome. So that's another syndrome. It's only in females, and that can cause issues with their menstrual period and also obesity. And so the weight loss surgery is actually a great solution for that also.
Okay.
What about you have people that it's complicated for a lot of people to, like for females, you see their stomach, no matter how much they work out, no matter what they do, they always have this.
Of course. Yeah, that's after pregnancy. And especially as you get older, we have more fatty deposits in our subcutaneous tissue around the lower abdominal area. And honestly, it's very hard to lose that fat. And so these are the women that end up going for a liposuction, cool sculpting, and I think that's completely fine. It's very hard to lose that.
I'm so glad you said that.
It's really hard. It's very hard. You can diet, you can lose as much weight as you want.
That fupa just don't be wanting to.
Fupa, yes. It's very hard to slim that down.
Yeah.
So that's just sits there for
Yeah, it does.
forever.
Yeah.
You could be skinny as hell.
And that
still
bloat,
have-
it's just like a bloat. I don't know.
What about guys though? Like a lot of guys I see, they would have six pack on top of that stomach.
Well, listen, guys are doing that, getting that done too.
lipo?
Oh yeah.
Oh yeah.
Yeah, I was. There was two
You know
men
some,
in the
they're getting
office
it
when I got
done.
it.
You know some.
Hey, that ain't what I got right here. Right now.
Guys are getting it done too. So
Is it possible for the stomach to be enlarged? Like if you eat a lot, does it
stretch?
enlarge your stomach? Yeah.
Well, it doesn't. Your stomach gets bigger. Your stomach can hold up to 4 liters, almost like let's say a gallon. On an empty stomach, it's about 50 cc's that's in your stomach. But what happens is people eat through, because of whatever issues, personal issues, social issues, habits, they eat through the regular signals to say stop eating.
Right.
And then it gets to a point where those signals don't work, or those signals get pushed back, and now they eat more and they eat more.
Right.
And then so that's how a lot of these issues happen.
Hey everyone, we are taking a quick break to let you know about Skyless Hair Studio located right here in Tamarack, Florida. So if you're in town and if you know anyone that need any hair services, we specialize in healthy hair, hair care, extensions, cuts, colors, and pretty much everything except for braiding. So reach out to us, Skyless Hair Studios here in Tamarack, Florida.
When I was going to school, they kind of broke down constipation and what causes constipation. I see you had a diagram on your Instagram that shows how the digestive system works, right? So for people that's like constantly constipated, what are these causes? Because when they told us about, you know, your food, it has to
Big time, your food and your diet. Now, there are some medications and things that will cause constipation. But really your diet. Are you getting enough fiber? Are you drinking enough water? Right? Water is huge. You'd be surprised. A lot of people don't drink water.
Right.
Yeah.
Don't take enough liquid in.
There's people I know that don't drink water.
They don't drink water at all.
Crazy.
It doesn't make any sense.
Yeah.
So you have to take enough water. You have to take enough fiber in. You can get your fiber from, you know, wheat, you know, whole wheat bread, and these type of things. And if you can't get it from there, you can get it from supplements. You can take a tablespoon or 2 teaspoons a day of fiber. And then you can also take stool softeners, which are over the counter if necessary. The problem with constipation is long-term constipation can lead to hemorrhoids, can lead to rectal prolapse, where your rectum is actually popping out of your butt. And it can lead to diverticulosis, which is a problem with your colon. And diverticulosis can lead to diverticulitis. And if you get diverticulitis, then you got to see me.
Okay. Well, you say, you know, you don't necessarily recommend the holistic ways as much.
Well, listen, I don't have an issue with holistic things. I think, you know, being, you know, healthy and everything, like you said, in moderation, eating properly, of course, it works.
Yeah.
What doesn't work is if you have an actual problem now, right? Like cancer or whatever it may be, and then you go towards a holistic approach. I can say this because the lady, you know, she wanted me to actually post her video. So I posted her video on my Instagram with her consent, because part of the issue was that if you go to my Instagram, you'll see it at Doncor MD, that tumor was 50 pounds. But she was counseled by her family and friends to take herbal supplements and have a holistic approach to it.
Like bush medicine, what we call it.
Yes. So, you know, we could have saved having to remove a 50-pound tumor. Maybe it would have been a 5-pound tumor, maybe a 10-pound tumor. So I'm saying those things are great, but you have to also keep in mind that it's not always the answer.
Especially if the pain is still there and you tried it all those, you know,
Tried
ways.
everything and it's still, you know.
Yeah, listen, you know, like I said, you know, you go see your doctor, get a good checkup, get a test done, make sure that everything is the way it's supposed to be.
Do you recommend teas for like constipation?
Yeah,
'Cause some
tea,
people
definitely.
say- Oh, really? I've heard that, you know, some people, well, non-doctors, non-certified people will say, well, tea isn't good, and you'll get like, you have to depend on it if you use it too much. But I think that it's a good thing to cleanse you if it's hard for you to
listen,
go.
I think tea is good. Tea is good if you have an upset stomach, and I think if you get your diet to the way the diet should be, you don't have to depend on it.
Is there a reason why tea always works for stuff like that? Like,
I don't know.
No, I'm talking about like the
same
detox.
reason.
No,
teas, though.
I'm
okay,
saying
yeah.
in general.
Oh,
Listen, the same reason why we rub Vicks, we put Vicks Vapor Rub, the same reason why we put Robitussin on our,
Right.
you know, it's just,
I just
that's
never
what we do.
understood It fixes everything.
That's
does.
funny. That's funny.
Dates too. I think dates was one thing that I see it helped a lot of people with constipation.
What is it?
Yes,
Dates?
Dates.
and prunes.
Yeah, prunes
Oh,
and
prunes, I know.
prunes is a little bit more like intense than dates, I think.
I don't know.
Okay.
I've never heard of dates. Is it a fruit?
Dates is like a raisin. It's like a family of a raisin, but it's bigger.
Oh, okay.
And
I might have tried that.
That'll get you going.
Oh, I might try that.
Right.
Yeah.
So she brought up detox, and I detox very often. But I usually do like I have two types of detox that I do. I have one that I do the herbal detox where you drink it one time. And
Okay.
You go to the bathroom for a couple hours.
Okay.
You flush out everything. I think it's like a colon cleanse.
Okay.
And then I have another one where I only do water and coconut water, and I do tea for like 3 days.
I like the second one.
The second one, that's all I do for that period. Like I feel like that resets my metabolism a lot when I do that one. So you don't recommend the first one?
I just don't know. I don't think you always know what they're putting in these. There's always a product and it's for sale, right?
Right.
So it's a commercialized product. They're selling you something. I will fast. I'll do intermittent fasting. So if I have a day where I didn't eat well, or I was working all day and I ate a bunch of stuff, I'll fast the next day. And I think, especially I love coconut water. Coconut water is very healthy. I just can't recommend a colon cleanse 'cause I just don't know where there's so many different products out there, and I don't know where they have the data that this, but again, whatever works for your body, whatever makes you feel good, and you're a healthy guy anyways.
Yeah, because a lot of times, because I'm pescatarian now. A lot of times when which
I think is great.
Right, I eat a lot of like seafood, but at the end of the day, I still eat like a lot of like bread. Like if I travel, that's all I can get to eat: rice, bread, like dumplings, stuff like that. But when I come back, I have to find a way to get that out. So the quick flush was something I was doing to just get all that out of my system. Then I'll do like a week later, I'll probably do that fasting, and I feel like my body goes back to normal.
So the question is, if you just took fiber in at a more consistent frequency, consistent rate, would you feel like you need to flush all the time?
Right. I don't know if I've kept my diet going like the right way with enough fiber, enough fruits, enough veggies. I don't think I would need to.
Yeah, you might not have to.
Right.
But I like the coconut water, dude. That sounds pretty cool.
Like,
I like
fasting
that.
on just liquids. To help
Yeah,
to
listen,
flush it better.
my patients that I'm about to set up to do weight loss surgery, they go on a 2-week liquid diet. They're 2 weeks liquid before, 2 weeks after.
So they just blend all their meals? Is that, or is it just...
No.
Okay.
They're not even blending. They're doing broth. They're doing vitamin water. They're doing protein shakes. Straight liquid.
So everything is just
for 2 weeks.
I tried that for 5 days.
For 2 weeks, because a lot of them, the liver is swollen and it's very fatty. So we need to shrink that liver before surgery.
I tried it. When I tried it, it gave me headaches. It gave me headaches for the first.
Yeah. If you get past that point where you're getting headaches, you'll be okay.
That's what I was told. Like the beginning of it, just to get over that hump.
Yeah, because I'll do 24-hour fasts.
Yeah.
Right.
And before it used to give me headaches, but now I'm able to get through it.
Okay, cool. Yeah. So now we're gonna get to the end of it where we get to.
So guys, we are gonna get to the Stretches Corner, and we are gonna talk about Gucci Mane and Keisha Kayor and the rapper
Big Scar.
So
basically, Big Scar, he was Gucci Mane's rapper. He signed him, and he died from a drug overdose. That's one of the things that's happening now. He died from a drug overdose, and
what was the drug? Do you know?
I have no idea, but I would think it's that what's it
called?
Fentanyl. That's
they're putting fentanyl in a lot, and
yeah. The problem is that there's a lot of drugs out there. So the problem with the drugs is that the drugs are laced, stepped on, mixed with whatever, and fentanyl is a opioid, right? So the original opioid is morphine. So where do you get morphine from? Morphine, you get it from the Middle East, Afghanistan. You get it from the opium plants, right? So typically fentanyl will be about, let's say, 7 to 8 times stronger than morphine.
Right. The morphine that is it the same thing that dentists use?
So we use it in surgery. You use it for post-op pain control.
They're downers, right? Those type of medications are like they put you to sleep.
So what they do is they slow down your respiratory system and they knock you out. They're very strong. So you have the morphine, you have Dilaudid, and you have fentanyl, which is the strongest one. Fentanyl is extremely strong, and if you end up, you could never do drugs in your life and take one hit of fentanyl and be done.
So you get hooked right away.
Not even hooked. You're dead. That's it. You stop breathing. So
they had go ahead.
So that's the danger of it, is you don't know what you're getting, and people are just the unfortunate thing with people that get hooked on these drugs, they need the strongest hit, right? So they're always looking for this next strongest hit, and so the stronger the hit, the more they get right to that point where it's the most dangerous.
Yeah.
That's the hit that they want, and they lace it with fentanyl.
I feel like a lot of things in life are connected because I feel like if you're smoking weed and you're increasing this THC and you're doing the THC like I see like Snoop Dogg and them doing with the crazy THC weed, I feel like when you get used to that now you're looking for the next.
No, I don't think so.
No?
I that's what I think.
I mean, it depends on the field that you're in and the people that you're around. You know, so if you got people that's on that high grade stuff, other than marijuana, but that's on the pills, on the coke, all that, you can fall into that. But you could get as high as a kite and be like, man, I'm straight. You know what I'm saying? Like, marijuana doesn't do that to you to where you're like, oh, I need more, and it's not like that. It's a calmer, and other drugs get you like that. Right. But weed is just, it's weed. Like, I don't know how else to say it. It doesn't do that. You know what I'm saying? Now, if you're around the people that does it and you don't really care about yourself and your well-being, then yeah, you can. They do say it's a gateway drug, but it's a gateway drug if there's people behind the gate ready to give you some other stuff. So it's who you're around that's gonna make you want to say, okay, let me try it. You know what I mean?
What about age? What age do you think is acceptable to start smoking
weed?
Yeah.
To start.
So me personally, I started smoking at 18.
Okay. So what about if you're 14?
So I know people that started smoking at 14 and they don't smoke anything other than marijuana. Now there is people that I do know people that does more crazier stuff. But I just understand that mentally, that if you know marijuana can get you to a place where you just want to chill and, you know, you might be a little, you'll be high off of it, whatever. You're not just going to automatically want the next thing that's going to get you there. Because weed is more like I'm chilling, you know? It's more like a chill drug. Like,
remember, like we always say, that one thing is not fit for everybody. You know
yeah, so I mean, and then there's other forms you could try it, and because marijuana is, there is medical aspects of it, you know what I'm saying, people that have cancer, it helps them, and it decreases the pain, with seizures, it decreases the pain. THC is nothing like morphine and all that other stuff.
No,
you know what I'm saying? It's
course,
not even close to that. I have asthma, you know, so, and I was born with it. So I went through life being on the craziest drug. When I lost my daughter, I was on some crazy stuff when I had a stillborn. And I was like, this is why people get addicted, because you feel that shit in your veins. You're like, oh my God, you feel like you could do anything, you know? And being in the hospital, I'm like, this is crazy. I don't understand, like, people, I understand now why they can get addicted, but I'm mentally strong, so that's nothing where I could be like, I need more of it or whatever. But it's, medical drugs is different from what the plants that grow out. And I must say, now in the marijuana industry, you gotta be careful, because you can still lace marijuana with certain things. So you have to know how the plant looks, you have to understand the plant and all these types of things. And it could be more of a risk now, but to me, I just don't think that it's that much of a gateway drug.
Right, makes sense.
You know?
So for people that what about people that's using the marijuana drug to get over something? For instance, like, there's people that the weed is not enough anymore to get over what it is they're battling. You get what I'm saying? What about that?
So I started smoking weed off of just wanting to try it.
Right.
I seen my grandparents smoke it, I seen my dad, I've seen my uncles, and they're good. They got great health.
Right.
So I never smoked weed. I never got into it on a depressed state of mind.
Right.
So I think if you get into it under a depressed state of mind, you feel the motion of it, you feel the effects of it. If you have to go to a substance because you're depressed, that means you can kind of almost go to anything when you're depressed. Right. You know what I'm saying? So it all depends on how you start. For me personally, I can't speak for everyone else, but I just know that I started off of, oh, let me try it. Oh my God, this is the best feeling. Oh my gosh, I'm laughing, I'm giggling, I want to eat, you know, I want to chill, and then I want to go to sleep. Like, that's all it's going to do.
Right.
But I don't know, everyone's different. If you started off of a depressed state of mind, and some people try it and they hate it because they feel they don't know how to handle it. And they rather drink, they rather take shots back to back, to back, you know?
I would say smoking marijuana is better than drinking.
Yeah. My dad right now, used to, he has a messed up liver. He drank rum and water,
Oh,
rum
yeah.
and milk is his life.
Alcohol will do that.
And everything is messed up down to his spine now is messed up, you know. And we had to cut it off. And he's in Jamaica, so I can't monitor him the way I want. But my brothers are monitoring him. And my brother was like, my dad stopped smoking weed maybe 5-6 years ago. My brother just had to get him back on smoking weed just so he don't drink. Now he's eating. Now he's getting
That's a
more
better
sleep.
option.
You know, it's working for him. He's not in the doctor's office every 2 weeks. You know, he feels a lot better.
Right.
So there is those, you know, the medical aspect of it that can help you. It's just not like those other strong drugs at all.
So I have one last question for you, Doc. I don't know if you're able to answer this question, but I'm going to ask you. But a lot of doctors, like the rumor was that a lot of doctors get paid from prescribing certain medications, and that certain medications get, like, those are the gateway drugs. Some of these medications that they prescribe for pain, for mental, like especially like psycho meds.
Yeah.
Like those are the what gets you hooked. But I heard there's a rumor that doctors get paid from some of these medications they prescribe, because I see people go to the doctor, they don't really need the meds, but they come home with a prescription.
Yeah. So I don't. That's, you know, I'm a surgeon, so I don't prescribe medications.
Right.
You know, it's kind of a hard question to answer because I'm not in that field of prescribing.
Yeah, you don't prescribe at all? Or just for after surgery medication?
I mean, I'll give you some pain medication after surgery, but that's it. I don't, you know. But there are doctors who deal specifically with pain, and they prescribe pain medications. Now, what I will tell you is that pain medications and prescription pills has been abused on both sides, patient side and doctor's side, and pharmacy side, right? Patients have gone and said, I've had patients come in my office, and they want pain medication so bad, they're telling me that they have so much problems in their stomach that they need surgery. Right? So they're willing to go under the knife just so they can get a script.
Wow.
Right? That's how serious it is. Then you have to go back, well, how did they get hooked? Well, they had a prescription of Percocet pills from a procedure, and boom, they got hooked. Some people just get hooked. And then I've had a patient where it was a young girl, and she was hooked on prescription medication. I said, how do you get these medications? And she was getting it, what she told me, allegedly she was getting it from another doctor and a pharmacist.
Right.
And so, you know, my thing is, as a physician, your job is to do no harm, to take care of your patients, treat everybody with respect. And so I don't think that prescribing medications you get paid, but definitely we have specialties where when you prescribe, that's your specialty. It's a pain doctor, you prescribe medication. But I do know a lot of good pain doctors that are very responsible with it. And I do know a lot of patients that will come in and put a lot of pressure on the doctors, hey, I need this, I need that. The other thing to know is that with the prescription drug market, right, you have these big pharmaceutical companies, right, that also were pushing these pills, especially back in the 80s and the 90s, right, early 2000s. What they were doing, they were, you know, going out here to say, oh, these pain medications are the best, and we didn't know at that time that these things were so addictive. Right. And then you have hospitals that are telling doctors that if your patient has pain or makes one complaint, then this is going to affect reimbursements and payments and the bottom line. So the whole thing was managed improperly. So now, especially as a patient, you have to be very aware, and and I'll tell patients, it's not, sometimes you're going to have some pain, and you have to do other things to deal with it, right? Yoga, breathing exercises. I haven't prescribed marijuana, but I'm not against it. And definitely better than prescription pain medications.
All right. And it's your time now.
So we are done with that topic, right?
Yes.
Okay, cool. All right, guys, so we're going to get into the quote of the week, and today's quote is, some struggle is healthy. If you can embrace it rather than be angry, you can use it as your pilot light. By Damon Wayans.
Oh, that's good. Damon Wayans.
Yes.
So it says some struggle is healthy, and that part I think it can be true for a lot of people. Some people look at struggles and problems in their lives as a stoplight. Like, this is where everything ends and everything circles around this, and it becomes your downfall. Where there's struggles that happen in your life that you could actually take that, use it as an experience, and use that as a stepping stone to move forward. You get what I'm saying? A lot of times you come out of a bad situation better than you went in because now your skills are more sharpened, your mind is more sharp, and you know not to make that same mistake on top of, again. So I feel like struggle is needed in everybody.
Yeah.
It's just like working out. When your muscle breaks down, that's where you get stronger. That's when you get better, when you break down that muscle. So struggle is needed in order to grow in certain areas of your life.
It reminds me of the quote of when they say no pain, no gain.
Right,
Exactly.
exactly.
So it's just one of those things you have to use to motivate you. And even though in that moment in time, it can seem like, there's no way out, but some of the times analyzing what that struggle is can be the answer to whatever issue or problem that you're going through, and just figuring out and getting over it. It's just a part of life.
I agree, and I think that it alludes to what I was saying earlier when I tell patients that you had surgery, you're going to have some pain. We got to get through the struggle first, and the struggle is going to make you stronger.
You're going to get better on the other side of it.
And if there's no struggle, what do you really gain from every experience?
Someone said to me before, they were like, would you rather stay in your house, we feed you, we clothe you, you live your best life, you do nothing, have no experiences, no problems at all, and you live your life in the house with no experiences? Would you rather that, or you rather just live your whole life with all the problems, all the struggles, everything that comes with life? Which one would you rather? And I would rather choose this life over here than stay in the house with 60, 70 years. You have no stories to tell.
No, nothing.
You haven't lived at all. You know what I'm saying? I'm able to tell people all the crazy accidents I've had, because I've had some freak accidents. My mom thought I was going to die.
Oh, Jesus.
And she thought I was just bad luck at some point. I have so much stitches all over my body, it's just crazy. But I would not give none of that up. You get what I'm saying? I wouldn't skip over any of it.
Because you wouldn't be who you are today.
Yeah, exactly.
Yeah, it allows you to access different parts of you and yourself and your mind that that you didn't even know that you can access by going through those struggles. So,
So that's prepared me for moments like this where I'm able to
persevere.
Yes, and pivot. All right, guys. So this is the end.
And Doc, I'm telling you right now, I really appreciate you coming in. We're gonna have you back. So
Yes, I'd love to. Yeah, definitely.
Because like I said, I told you we shaved off a lot of the questions. So for next time, we're gonna have you come back because we need, our people need to hear this. We're Caribbean, so
of course,
a lot of our audience are Caribbean also, and they need to hear a lot of this stuff because this is why we do the podcast. We try to get people to learn and also unlearn all the bad habits that we've developed from slavery until now.
Yes.
So I'll tell you, I appreciate you for coming.
Thank you.
And appreciate it. Come back at some point.
Thank you very much. Appreciate
it. It was
that.
an amazing experience.
Thank you so much.
Thank you so much.
Thank you.
Yes.
Well, make sure you subscribe, make sure you like, make sure you leave a comment, make sure you share with a family, with friends.
Yes.
Thank you for tuning in.
Have a good one, guys. Bye.